Right, let's take you to KwaZulu-Natal, where healthcare workers have begun receiving the COVID-19 Johnson & Johnson vaccine. I went across now to Jayed-Leigh Paulse, who is live for us at Grace Hospital in Pietermaritzburg, where South Africa's first identified COVID-19 patient was treated. Jayed-Leigh, a very good morning to you. Look, it's almost a year on, isn't it, since the first patient was identified here in South Africa. The pain of the pandemic is all too apparent, but I guess there's a measure of solace here. That is the healthcare workers, the frontline workers who are still putting their shoulders to the wheel and still able and willing to assist in this fight against COVID-19. How are they feeling almost a year on and now that the vaccines are being rolled out?
Well, a very good morning to you, Blaine, and to the viewers back at home. Here at Grace Hospital, a lot of excitement. I mean, as we know, the vaccines have arrived in South Africa and we saw them being rolled out in the Western Cape, in the Eastern Cape. But here in KwaZulu-Natal, my colleague Vusi Khumalo has been covering that leg at Prince Mshiyeni, speaking to the Premier, receiving that batch of vaccinations. But it's right that you said, Blaine, it's a very special day for people of KwaZulu-Natal. As you would know, we've come full circle, 360 degrees, coming from, Grey Hospital, where that first person that was identified to have coronavirus in the country was brought to this particular hospital to receive assistance. And we spoke to the physicians earlier on, and they were telling us, that he was a very positive patient, that he never gave up, and when his family was also admitted, that they fought until they recovered. So a lot of excitement here, knowing that the vaccine has arrived in KwaZulu-Natal. But I want to go behind the scenes, Blaine, and speak to, the management of the hospital and find out how they were feeling just a year ago on the 1st of March when we received that news that there was a case of coronavirus in the country. I am joined by Dr. Carolyn Lee. Thank you so much for joining us on SABC News. I want to go back to last year when you received the news that Grace Hospital was identified to receive that first patient. What was going through your mind? You did tell me, that you were on leave. Take us back to that moment.
Well, I must say, it feels like a lifetime ago. I think everybody in the world who's been touched by this pandemic feels that way. I distinctly remember being on leave that day and getting called to say that we were admitted this case of coronavirus. And a part of me was disbelieving at first. We'd been preparing as a management team from about January, February. As we heard about the cases in China, we'd been preparing for that eventuality. And I'll be honest when I say that my colleagues and I were busy thinking, Pietermaritzburg's not going to get the first case. We're too far off the global beaten track. The first case is going to be flown into Gauteng. So we had our preparations and never really expected to see the first case in South Africa. So on that day, when I was phoned, I thought, surely this is a joke. And then it became apparent that it wasn't. I think that for me, the fear wasn't so much the unknown as were we ready. And I'm pleased to say that my team were ready. I know you've interviewed some of my colleagues this morning who drove the team, and I can't applaud my team both at a management and on a ground level of how much they did to manage the unknown on that day. I think that what struck me over that period was a little bit of what we were saying, medicine is a little bit of rush, wait. So we spent 2 months preparing for this, and then we rushed. And after the first patient recovered, there was a little bit of a lull. We started to see cases come across the country. And that little lull period, I must say, allowed us to take stock of, are we ready? And it was clear that there were a lot of unknowns at that stage. You'll remember at that stage, no one was wearing face masks in public. We weren't sure about the mode of transmission. So we were basically prepared for something Ebola-like in our unit. Thankfully, it's not turned out to be as severe as that, but still requiring a lot of preparation. My team, I think, since that time have developed in a lot of ways. I mean, obviously, the medical knowledge has improved over the last year. We've got new strategies, new medications, a lot more science behind what we do. The one thing that I think that I don't think we emphasized enough was how long this is going to take for this pandemic to resolve. And the the resilience that we've had to see in people. And I think that's one of the things that's stood out for me in the last year. So I don't know if you want me to go into a little bit about how I
just want to come in there, Dr. Leigh. You know, when I spoke to your colleagues earlier, visibly emotional, because I mean it's a big thing for the entire country receiving the vaccine. It's been a very difficult year, and we've lost so many people, so many loved ones. For healthcare workers, how has it been for the people in the front line, having to get up every morning and fight an invisible enemy?
I think that a lot of people who get into healthcare do it because they want to make a difference. And as part of that spirit of wanting to help in the face of adversity, and you know we deal with adversity every day, never on the scale though. So I think and I speak for myself and perhaps for some of my colleagues, I must say I didn't wake up fearing for my life on a daily basis thinking I might get coronavirus, because we know it can be beaten. And if you wake up saying, I'm going to go and I'm going to get this illness and I'm going to die, I can't go to work, you're not going to firstly be able to do your job. But secondly, you know, as humans, the spirit of survival and the spirit that we have as a community, you know, I think we underestimate how tough we are as a species. So for the frontline workers, I think, for me, for example, if we just put it down to practical levels, as frontline workers during that hard lockdown, we had to come to work every day. But I had kids at home that at that stage homeschooling wasn't even a thing yet. It was just kids told to stay home, not having the ability to get helpers come in. And even though, for example, you have an elderly grandparent who could help, you don't want to expose them to the risk. So it's on a practical level. I think healthcare workers faced exactly what everybody else was facing. How am I going to take care of my kids? You know, I think that from that perspective, we bore the same burdens on top of the need to come to work. My colleagues, and I can't take my hat off enough to all of them across, and it's not just healthcare workers, anybody who had to do their job, journalists had to do their job. You know, and I don't know if you felt like every morning you're putting your lives at risk. I mean, I know we probably were, but I didn't feel that way. And I don't know if that's something that's built into our training, as you know you're going to be exposed to infectious diseases or dangerous circumstances as a healthcare practitioner. So I wasn't worried about the physical risk so much as the emotional burden that my staff were carrying every day. I think that's an underdiagnosed risk that we don't put enough emphasis on.
But I think the country salutes every single healthcare worker, including yourself, Dr. Leigh, for being in the forefront, being one of the first physicians, hands-on management, hands-on receiving that first index patient a year ago. And I salute you. I really do. Thank you so much for your time.
No problem. Thank you very much.
Blaine, I just quickly want to show you here at Grey's Hospital, since the first case and obviously the infection rate that increased in KwaZulu-Natal, there has been a lot of development. I'm just going to step out of shot, and Ray and Bailey can show you on the screens. There's a lot of development that is taking place. There were tents that were erected, and now they are also building additional facilities that will assist us in trying to test as many people as possible, not only here at this hospital, but throughout the province. I'm going to be speaking to Matron Mackenzie. Matron Mackenzie, thank you so much for joining us. Off air, you were telling me about the developments that are taking place here at Grey's Hospital in ensuring that more people get tested every single day. Yes. Can you take us through that?
Yeah, over the year that we've been working with this, we've had, luckily, the Army have helped us out with some tents. The Gift of the Givers also helped us with tents, and we now have built some structures. One that was done by the Department of Health, and one which was done by the Muslim Society, which is the one that's not quite finished yet, but will be finished in the next 2 days. These facilities help us to look after patients and test them, assess them prior to them entering into the hospital to keep the other patients safe. So it has been working very, very well. We have a team of nursing staff that are working out here. There's a team of doctors that are here that are rotating through this section and making sure that the patients are well looked after, seen to, assess quickly, and directed in the correct direction. So if they're negative, they go to the various clinics that they've come to, or if they're positive, we then see that they get admitted to the appropriate facility. Yeah.
Before I let you go, I just want to ask you, it's obviously been a very challenging year for healthcare workers, and we've seen the vaccination being rolled out across several of the provinces.
Yes.
What is your special message for your colleagues?
Well, I must say that I'm very, very proud of all the nurses at Gray's Hospital and the doctors as well, but specifically the nurses, because they're with the patients 24/7 and they have done a sterling job. They really have done a fantastic job. Our vaccination rollout is complete. We have a site inside for vaccination while this has been erected. Once it is complete, then what we've put together outside. The nursing staff are very pleased that the vaccine is coming, and that will help us in the future. So it's a very positive atmosphere within the hospital as far as the vaccine rollout is concerned.
Thank you so much, Matron Mackenzie, and all the best with the rollout program.
Thank you.
Well, there, Blaine, as you can see, she was talking about the tents that were erected by the Army, assisting during that very difficult time when COVID-19 had just hit South Africa. The Army came out full force supporting various hospitals, but now they are also subsequently building several little buildings that will assist in the turnaround time with testing, and therefore it will also help with ensuring that they find out how many people are being tested on a daily basis and redirect those people to the necessary facilities. But also saying there that they are ready for the vaccination to be received at Gray's Hospital. There is a department here that will be dealing with that. And with that, Blaine, it's back to you in studio.
Jayed-Leigh, the likes of Dr. Lee there and other frontline workers are truly among the best of us, isn't it? I often call them our angels here on earth. No matter what the emotional trauma, the burden, you heard from Dr. Lee talking about the emotional burden that they go through, still they pursue, they help, and I guess it's a good day for them knowing that the vaccine is at hand and hopefully it'll work. Definitely our collective fate will be greatly influenced by what happens over the next couple of months with regards to achieving this herd immunity, but no doubt we salute them. Jayed-Leigh, we appreciate your reporting as well. Be well. Thank you.